few years ago, we embarked on a study at the London School of Hygiene and Tropical Medicine just before I returned to Australia. And we took data from a number of developing country cities to try and understand what the relationship between variations in daily temperature and death rates were. And here are some of the data from Delhi for that 4-year period. You can see the seasonal swings, summer and winter. We then have taken those data and rearranged them. So we've expressed the risk of death in relation to daily mean temperature across that full period. And you can see that the red graph shows quite clearly that whilst there's a slight rise in risk over there on the left-hand side as you get into the colder parts of winter, almost all of the increase in risk is on the right as temperatures rise. And if we're heading for a world where daily temperatures in Delhi may not be just summertime, 39, 40, but might get up to 43, 44, 45, 50, those sorts of extremes, and that graph goes up more steeply, then we will have, of course, much greater risks. Here's the distribution of daily temperatures at the moment, just figuratively. It could shift to the right then, as I've just described, but with more variability as well, there'll be an even greater frequency of very, very hot and perhaps very cold days. Something that gets overlooked, and I haven't presented these data to anyone before, they're from a colleague, Tord Shellstrom and friends, unpublished, but he works with my research group in Canberra, and he's raised the question as to what do we know about the effects of extremes of temperature on people in the workplace, particularly those outdoors, those not with air conditioning, those exposed directly to the elements. And whilst we normally think about measuring temperature, he's pointed out that as the biometeorologists have known, we need to be actually using this better measure of wet bulb global temperature, which integrates all of the measures there, the maximum, average and minimum temperature, the absolute humidity, the wind speed. And you can see that in Delhi over the last 45 years or so, whilst temperatures haven't obviously increased, the maximum temperature has a bit, the things that have increased have been absolute humidity or decreased wind speed, and those things together have meant a rise in the heat stress at work. And he points out that for people doing light jobs, 200 watts expenditure, or heavy jobs, 500 watts, the number of fully workable days in terms of physiological capacity declines quite rapidly as you add extra degrees of temperature to the average current temperature. So that if you're adding another 7 degrees centigrade, you'll be approximately halving the number of fully workable days in a year. It'll also be affecting mood and behaviour and risks of accidents at work, an area that I think we need to pay attention to. I talked about estimating current burdens. This is more of a statistical exercise. And this was our best attempt a few years ago, working with the World Health Organization as part of their Global Burden of Disease project, to estimate currently just how many deaths, at least from those things for which we had some background climate health arithmetic, like deaths and injuries from floods, malaria, diarrheal disease, malnutrition, how many might be attributable around the world. We did that for the year 2000, shown in green, and for 2030, shown in red. On the left, total deaths in thousands. On the right, the total burden of disease, disability-adjusted life years lost in millions. And you can see that most of the burden, as best we were able to estimate it, this was a very limited exercise, it was a first look, it is to do with malnutrition, quite a lot to do with child diarrhea, things that remain important issues here in India. This shows us the regional distribution, as we estimated it, for these burdens of extra death attributable to climate change. We're talking about 0.6, 0.7 degrees centigrade rise that's occurred over the last three decades or so. And you see for South Asia that the rates are relatively high. If we look at this in another way and say, well, how fair is this distribution of burden? Here on the one hand is how you might portray the recent and current emissions of greenhouse gases. Who are the big emitters? And you can guess what the next slide shows us. Where will the impacts be? Our our estimation, most of them are in sub-Saharan Africa and many of them in South Asia. These are two high-risk areas. But there are the emitters. There, for the moment, where we think the resultant burden of disease is. So this is a great moral issue for the world at large. We don't have a system of governance that's actually very well equipped to help us find our way through this and decide what sorts of policies at national and regional levels would be both effective and equitable. Still live in a world, unfortunately, of rather competitive nation states. Okay, so let's look in just a little more detail at those two major areas of risk that I mentioned a little earlier, both of which apply here in India, effects on food and nutrition and on infectious disease patterns. Of course, we have a background problem already, and it looks as if it's been exacerbated quite recently by this dramatic 40% increase in the World Food Price Index last year. It's the highest annual increase on record. And you'll see that the head of the World Food Programme has described this price rise as due to a perfect storm, a convergence of negative factors. The increasing demand for grain as animal feed, and particularly in China, but India is also now contributing to that. The diversion of land for biofuels production as opposed to human food production. She mentioned climate change and some of its regional impacts, and of course the rising costs of fertiliser and fuel energy because of the background increases in oil. So it's not a promising situation to which climate change is beginning to contribute. The distribution of malnutrition and hunger, as we've said, is very uneven around the world, and we're likely to exacerbate that further. It may also have an interesting geographic dimension to it that we're only just now beginning to understand from climate scientists, who've pointed out that that as the world warms, the great rainfall systems and the monsoons, upon which a lot of our daily life patterns and our agriculture depend, are going to be pushed away from the equators and towards the poles. That was part of the modelling that they undertook here, to try to foresee what proportion of land area in the future was likely to be experiencing severe or extreme drought. It's a pretty dramatic graph, even if you divide it by two. It's still a worry for us, particularly countries like yours and mine in Australia that have mid-latitude agricultural regions. Food yields. Let's think about cereal grains. They're the major source of food energy in the world. Show this sort of relationship in terms of how temperature affects photosynthesis. Many studies have tried to estimate how an increase in global temperatures would affect food yields, and this one is a bit higher than the average estimate actually, but it's a recent one, suggesting that a 1 degree centigrade rise would reduce yields by 6 to 10%. And if you imagine then a 2 degree centigrade rise that they refer to, pointing either to that side, where you're already living in hot conditions, that could cause quite a marked decline in productivity. On the other hand, if you're living in Canada or Siberia or Scandinavia, the Ukraine, and you experience a 2 degree centigrade rise, that could be good for agricultural yields. And this is going to contribute to some of these inequalities in the world and possibly to future geopolitical tensions if we're not clever enough to understand, do the research and incorporate an understanding of these things in our big policies. And that reduces to these sorts of estimations then from another study from the International Institute for Applied Systems Analysis, published last year, on how cereal grain production might decline by later this century as a result of climate change. And you can see for South Asia, the figures are particularly worrying. And of course, this is against the background of quite high vulnerability in many of these countries, and you'd recognise many of these issues as you read through them. Again, it's not climate change on its own, it's climate change in combination with a number of other environmental, social, economic, demographic stresses in the modern world.